Hey there, and welcome to the Think Fitness Life podcast. We're fueled by the incredible clients who inspire us every day, allowing us to elevate their health and fitness journeys. On this show, you'll gain valuable insights from top professionals, hear inspiring transformation stories, and discover the knowledge and motivation to create your own best life. Let's dive in. As someone who has continuously used therapy as a way to heal and elevate my personal performance, I know wholeheartedly that you cannot always read the label when you're in the jar. And that's why it's so helpful to have a professional in your corner to talk to. This podcast is sponsored by BetterHelp to provide our listeners with the opportunity to work with a licensed therapist from the comfort of your own home. Receive 10% off your first month when you sign up by going to betterhelp.com/TFL. That's betterhelp.com/T as in think, F as in fitness, L as in life. And remember, you're not alone. There are people out there who can help.
All right, welcome back to the Think Fitness Life podcast, where we also dive into the world of health and wellness, fitness, nutrition, mindset. Today's going to be a little bit of a combination of both. As most of you listeners know, that I work in sports medicine in that field as a strength and conditioning coach attached to a hospital. But what many people don't understand about the hospital side of things is sometimes certain doctors, they give layman's terms, or they give terms out that people really don't understand, or they talk about things at a level where they don't go into depth. And most of the time, sometimes patients are left questioning. They'll come to myself or my other coaches with more questions than answers when it comes to biomechanics or gait retraining. And that's not to fault the doctors themselves at home, because they've had a limited amount of training in what they do in many different fields. But when we start to whittle down, especially in the orthopedics world, it becomes very educated in orthopedics, which is a good thing. But sometimes that world of orthopedics gets really narrow, and people forget that orthopedics is also connected to a bigger, complex system, the human body. And we're going to dive into that today. We have Dr. Sean Altman on, who is a functional medicine doctor and orthopedic expert. And he's going to dive into what he does, what he's designed, what his practice looks, which might be a little bit different from what you've heard in the past coming from your standard orthopedic doctor. Dr. Sean, welcome on.
Thank you. It's a pleasure to be on here. My original background is sports and conditioning, strength and conditioning training. I've had a ACE personal certification for 25 plus years, grew up playing ice hockey. So I'm no stranger to injuries, and it led me down the orthopedic pathway. But you had just explained, I realized in terms of the training that I received and just in terms of learning more and more about my patient's struggles, that the body was, you have to go back to the body as a unit and think about it more holistically, more functionally, in order to understand how these injuries and areas of pain manifest themselves. So that's where I've come up with this hybrid approach that I've started to call orthopedic functional medicine, where I'm not just looking at where a person has pain, say they have knee pain because of arthritis and a meniscus tear. I'm also looking at the rest of their body, how it moves as a whole, how the hip, how the lumbar spine moves, how the ankle moves, and then how it moves during functional movements, gait, running, and other functional activities. And when you start to put all those things together, then it becomes much easier to understand the mechanism behind the injury and the reason why a patient may not be getting better from just traditional therapeutic means. And then yourself, my goal in clinic as well as on social platforms is education. I want my patients and my followers to better understand their bodies and to understand that there's a lot that you can do to get yourself better through exercise, movement, stretching, lifestyle choices. There are a lot of things that you can do to start moving the ball in the right direction. And then if you get the right people behind you, the right team behind you, really the sky's the limit.
Yeah, and often I wonder if a lot of orthopedists have that kind of sticking point you were talking about where you just ask these questions or is there something else that's going on here? There's something else that I can learn as a coach or as a doctor that can better the health of my patients. For you, when was that? I'm sure you hit a certain point.
I think it was very much personal. I suffered many injuries over the years playing ice hockey. And I realized when I started to pursue my own orthopedic care, how often the initial diagnoses were off the mark
Mhm.
and how often there were underlying issues that were being missed that ultimately I had to uncover on my own. And it planted this seed in my mind how I didn't want the same experience for my patients. I wanted them to really be getting at the root cause of the things that they had going on. And that's why I've always loved the study of things like biomechanics and even just the application of biomechanics principles to various movements. One of the things that I really enjoyed becoming certified in is golf. So I studied under the Titleist Performance Institute. And when you start to learn about the biomechanics of something like the golf swing, there's so much physics and nuance around it. And it really just exemplifies how all of the segments of the body are involved in the swing. And you can't treat each segment in isolation. If someone has golfer's elbow from golf, the pain is in the elbow, but it's linked most likely to a particular swing flaw, which is linked to a mobility restriction in a certain area, as well as most likely a motor coordination problem in terms of the way that they're hitting the ball that's putting too much force through the elbow. And understanding that really helped me to realize that you can apply that to virtually any movement, throwing a baseball, swinging a bat, running. And when you start to think about the body in terms of all of those pieces working together, you start to realize that the only way to truly treat an injury is to look at the whole body and then to whittle down the important parts that are involved, not to tunnel vision and focus on that one area, because inevitably you're going to miss a lot if you do that.
And that's one aspect that I always tell clients, patients, and people I see is no, I don't want to blame doctors and say they're kind of behind the eight ball. And some of them are. Some of them, they've been doing it for so long and that's their method and that's their style. And it might work to a certain degree, but I always find people have those questions of how did I get here? Especially when they go and get images and there's nothing there. If you have a break or a tear, an ACL or something, okay, understand the mechanism of what happened. But a lot of times people go for imaging and there's nothing there. And I always tell people it could be an inflamed tissue or a tension that you might not see on an image, and their brains are starting to turn. They go, like, but I'm having pain. What's causing this? And if you said it's a certain area, you just can't target that because it's only going to get you so far. And then it goes into, yeah, if you go to PT or you treat that, that doesn't mean you've changed the pattern. You've just changed the pain perception of an area. And eventually it might come back.
Absolutely. And to be completely transparent, some of this is really due to the system. I at one point I was director of rehabilitation at St. John's Riverside Hospital, which is based here in New York. And when I was there, I really saw the inner workings of how these hospital systems work, which is to say that everything is very specialized and subspecialized. So it's when you're within a hospital system or an orthopedic group system or these other particular groups, you're often pigeonholed into treating a specific way. And sometimes it's not the fault of the clinician. Very, very often it's not the fault of the clinician. It's just they're in a system where they're really not permitted or they're not able to look outside of that box. They're really confined to the box. So I think and ultimately that's why I went out of the system so I could, because in private practice, you can make those decisions. You can have the autonomy and the ability to treat multiple areas at once. So I just want to put that out there so people don't vilify the docs out there because they're doing their best. It's just sometimes they're in a difficult spot.
Oh, 100%.
And it's really, my understanding has become that I think it's incumbent upon the patient or the client to pursue the care that they need, because they may, if their doctor's not able to provide that, it's not always their fault. They may just need to go somewhere else to get what they need because of the way the system is built.
And what we'll find eventually, and some even now, you're seeing some of those systems starting to change to do what you do more to try to catch up, because people, and in fairness, are starting to go into these broader approaches to look for what's actually going on at the system level rather than this specificity. And I think we're going to see a lot of these old, bigger hospital systems start to change their model a little bit in orthopedics for certain things, especially when it comes to sports and movement and stuff, to allow them to be a little bit more marketable to compete, honestly, to compete with what you do. And that's why a lot of doctors are now going into your world of the functional medicine world and combining everything together, because there's this great movement now saying everything's connected and you can't just look at one thing. It doesn't exist in the human body. You can't change one thing and not alter something else.
For sure. And it's a good thing. Questioning these systems, trying to understand how the body works, looking at it from this, we call it systems biology standpoint, we start to realize how all of these things contribute to one another. Diet, lifestyle, exercise, sleep, all of these things help us to not only have more vitality and be healthier on a daily basis, but even more importantly, they affect our ability to heal from injury, to recover from activity, from exercise, from sports, from all of those things. And that's an important distinction to understand as well. Some people, and a lot of people I come across, they can get stuck with a tendonitis or a bursitis or a chronic inflammatory issue, obviously because there's an initial injury and there's a muscular imbalance, but a portion of the reason they're not able to get over it is because of metabolic issues, because of lifestyle factors that are creating additional inflammation and making it that much harder for their body to get better. And I think we're really getting to the point where more and more clinicians and patients are understanding that connection. And it's a good thing. It really is.
Yeah, when you have patients ask those questions, you asked about metabolic, do they look at you a little bit, okay, why are you asking me about this? Kind of blindsiding them, because they, in fairness, they don't put that together in the recovery or healing process.
Absolutely. They ask initially, but then from that educational standpoint, I try to relate it immediately to the current things that they are going through and often the symptoms they're experiencing. Someone who is stuck with a chronic pain and their body has a metabolic crisis, an energetic crisis because of poor health, is going to be experiencing fatigue often on a daily basis. And that's the reason, is that their body is not producing and not utilizing energy efficiently enough to heal, to get better. And when I ask them if they're fatigued, they're often, how do you know that? And it's your labs. I'm looking at your data, and then that starts to reel them in and helps them understand the connection. My thinking has always been knowledge is power. If you understand your body and how it works better, you're in a much better place to take care of it in the long term. I want my patients leaving with a sense of empowerment, knowing that there are things that they personally can do to change their life. They don't need to rely entirely upon medicine and just in the sense of medication and treatments to get the care and the help that they need.
I think a lot of people expect that. And then when you come from a different approach, they are shocked and, oh, this is something different I haven't tried. And in fairness, some people do get worn out from that. Hey, I got to go on medication. I've tried this. It doesn't work. It worked. Hence why people are starting to find people like you, which is taking functional medicine. If people don't really know what that is, you're going to do labs for sure, no matter what. That was one, it's not all functional medicine, but that's one big thing, is they're looking at how your system functions. Then you take your orthopedic background and you're just going to crash those two together to get a really good picture of what the body's doing inside from a functional standpoint and an overall movement pattern standpoint. And people, if they're not used to it, it's going to be a lot for them, but they're going to get a real in-depth look at how the system is working. And I would say labs are one of the best ways to do that, to see what's really kind of going on underneath the skin and muscles we have.
Absolutely. And they help when you do consistent labs, it helps you to measure changes and to look at patterns. One of my colleagues has the saying, test, don't guess. And that's the idea, is data really can be powerful. Another area of data which really crosses over very nicely into your world is I have what's called a staiku. So it's for three-dimensional body composition, bone density, lean muscle mass analysis. And then I also do VO2 max and RMR testing to identify a patient's health that comes in as a baseline, but then also to measure response to interventions. They get on a weight training program, they start eating healthier. We want to see if they're making the improvements that we're looking for. And on the other hand, we do have patients who are overweight, who are trying to lose weight on some of these GLP-1s, tirzepatide and semaglutide. And we want to make sure that their body mass is changing in the right direction, that they are losing fat, but they're not losing too much muscle. And that's something that can happen if you're not following the appropriate dietary guidelines in terms of protein consumption, and you're not doing enough weight training and exercise training consistently. So I think this idea of advanced testing and monitoring patterns is really such an effective way to treat the human body physically, metabolically, across the board, because that's how we actually know what's really going on under the surface. Otherwise, we're just going based off of how someone feels, and that can be misleading. We've all heard of the, quote, skinny fat people. There are people who they're in great health from the outside, and then you do labs on them, you do a body bone density analysis, you do the, body composition analysis, and they are in terrible health. And they're actually doing very poorly. So we can't just go by looks alone or by reported symptoms alone. We need data to know really what is going on under the surface, and then to identify trends and to steer the ship on course when needed.
And it kind of gets back to what you said earlier about the limitations that some hospitals and practitioners have because of their whoever's overarching or overseeing their now it's not a private practice, their kind of their reign of rule, because a lot of times you go to a general doctor and they do some blood work, but it's not in depth. I always tell people, if you were teaching people and educating, I always get as much as my insurance gets, give me full in-depth labs. I want to see everything and I want to go over everything. And you said you have to test that constantly. It can't just be, oh, I feel good, you're in, you're out, and then that's it, because you don't know. And you want to see these trends once or twice a year, or I don't know, maybe you guys do more of what's actually going on, because then you get the buy-in from that person, from the patient, from the client. They're, oh, I see this a lot differently than you just saying, okay, you got to eat 1 gram of protein per body pound. Someone's gonna be, but if they see it on that scan, or they see it in the numbers and they see things changing, they're, oh, I understand this more. My health is more important now because there's tests and numbers that back it up.
Yeah, and the patterns are so important to track as well. I've come across a lot of patients that, in men, one of the common things is low testosterone. And the traditional panels for testosterone aren't always comprehensive. You want to be testing free and the various hormones related to it. But even more in a general sense, you want to look at the pattern of it declining. And if there's a more rapid decline at a certain point that's atypical, then, that means that there's a problem. Even if the number is, quote, still within the normal range, we would say it's in the normal range, but it's not optimal for you. And normal range might be that you feel sluggish and really weak, but you can get through the day. I don't know about you, but for me, that doesn't cut it. That's not how I want to be. I want to have energy. I want to feel good. I don't want to feel okay. I don't want to just get a D+.
Right.
score. I have to excel. I have to feel I'm doing well with my life.
I think that's where
So-
people, when they hear normal, or they use that word too often. Oh, it's normal. Okay, is normal average? Who wants to be average? I don't. As you
Right.
said, I don't want a D plus, C plus. I want to be optimizing health no matter what. But I think people get so complacent with, oh, hey, I'm in the normal range, I'm good, because some health professionals are saying, hey, normal is okay. You and I, normal's not okay. Hey, how can we optimize anything? I don't care if it's in the weight room, out running, on the track and field, in overall health. How can we push those numbers to be optimized for optimal longevity?
Yeah, I think that you want to have a buffer. Peter Attia, who a little bit controversial with some of the more recent things, but he does have a thought that I really is. He said, his thinking is you want to be 10 years ahead of each category for biological age in terms of your muscle strength and all of your labs and all of that. So that if you get hospitalized with some sort of problem, you have a major injury, major occurrence, etc., even if you lose some of that progress, there's a buffer, and you're not way behind where you're just trying to get back to normal. And I think that makes so much sense to have that little bit of a cushion where you can live comfortably and you're not just making it. You can go up and down 2 flights of stairs easily instead of you can just make it up those 2 flights of stairs. And then if your knee starts hurting, you can't make it up those stairs anymore. That's the difference between doing it comfortably and just being able to make it.
Yeah, a lot of people, I would assume they're in that ladder. Hey, they got to get more with it, right?
Yeah.
You got to really pull your health up to a standard that's going to be what that person wants to be. And that's why we have these conversations. We sit down and we're trying to get people to push their health standard higher, to kind of have those questions towards the older models of healthcare provider. Even for me, the older models of strength and conditioning, the older models of training, how can we question that to say, hey, can we make the model better to fit overall better performance of the human system? And it can be done 100%.
Yeah. And there's been such tremendous development in the past 5-10 years, in terms of our understanding. And I love that about exercise science. We're now recommending ice less frequently, heat and blood flow sooner to accelerate recovery. It's an evolving science. And I think that's great to push the boundaries and to make our decisions more personalized and just make sure we're staying up to date on research and giving people the best advice and programming we can.
Yeah, and I was reading through some of your stuff. You have a very different approach from an orthopedic standpoint than maybe than what I've dealt with some doctors, and I think some doctors are coming up to this, but you're very much. So first of all, you have your own kind of, you call it, what's it, the
Altman method.
The Altman method. We'll dive into that, but kind of walk us through. Someone comes in your old orthopedic way, you're going to get images. They're probably going to recommend some sort of treatment, PT. I'm going to say there are doctors in the past. It's not very common, at least I've noticed anyway, that will do releases. They'll cut tissue to do stuff. You have a little bit of a different approach to managing tissue in the system. Walk us through how you got to that model.
Sure. And it's based on what we've talked about earlier, my own personal experience. I think in no small fact, my strength and conditioning background and just study of exercise has helped me put this together in terms of looking at the body in terms of these movements. But basically, the Altman method is 4 parts: structure, chemistry, nervous system, and energy. And I'll go through them quickly. I don't want to bore people too much. Structure is basically what traditional orthopedics is based around. It's looking at the individual joint structure, doing the x-rays, doing the MRIs, assessing any joint or structural level damage that may exist. And then when in the orthopedic world, it typically involves something like cortisone injection or a gel injection or putting someone on anti-inflammatories, treating that structural issue, and then recommending PT to strengthen to compensate around it. My structural analysis is more whole body. So it's looking at the adjacent joints around it, be it if it's the knee, it's looking at the hip pelvis and the ankle. If it's the elbow, I'm looking at the shoulder and then the wrist, etc. And then assessing if there's any structural issues above or below it. And then I'm also looking for, at that joint level, if there is any micro instability. So that's something that I find traditional orthopedics tends to miss, is that there can be ligament damage or even just overstretched ligaments and connective tissue, the type of stuff that wouldn't show up on an MRI, but would manifest itself clinically in terms of excessive mobility in a specific joint. And that could be an underlying cause of the pain or of the dysfunction that gets missed. I saw a patient earlier today. She has had this chronic tennis elbow for a long period of time. And her problem is a lot of typical tennis elbow. Is there, instead of it being a tendonitis, there's a bit of a tear in the common extensor tendon of her elbow. We see this all the time in people who have recalcitrant. So that's tennis elbow that doesn't respond to traditional treatment or to regular care. But in addition, she also has a small tear in her radial collateral ligament, which is the ligament that surrounds the head of the radius. And that's causing excess friction, excess movement of that elbow joint. So when she tries to play tennis or golf, she gets tremendous elbow pain and her elbow swells up after she plays. So this is not a typical case of tennis elbow. And fortunately, I was able to see her before she got a cortisone shot, because if she had gotten one, most likely it would have caused the area with the damage to get worse over time, potentially leading to a necessary elbow surgery, which I have seen people who've gotten multiple cortisone shots. So the next part is chemistry. So chemistry is looking at the lab work. And then I am a fan of incorporating things, supplements, peptides, etc., when the labs call for it, when it's appropriate, when there are deficiencies or there's an evidence that the body is challenged in those particular areas. But as I said before, we test, don't guess. I'm not a fan of just trying a whole bunch of different peptides and supplements without having appropriate research or data behind it, because it could help, or it could actually be more of just a placebo where you think it's helping and it gets you better. And then it may not have been necessary to take those in the first place. And then we move on to the nervous system. Nervous system is something that has become much, much more popular lately. And we're realizing more and more how absolutely vital the nervous system is for healing, for recovery, for management of inflammation, and so many other things. And it's about having nervous system balance. So having the ability to turn the nervous system up when we are challenging it, when we are doing challenging activities, heavier weight training, Olympic lifts, sprinting, running, max lifts, playing a particular sport, but then having it be able to de-escalate, to calm down and enter parasympathetic mode when we need to rest, when we're just relaxing on the couch, when we are sleeping at night. And if we're not able to have that balance between the two, and we're stuck in more of an upregulated state, our body remains inflamed. The pain that we perceive is exacerbated and exaggerated. And it gets us in this position where we get stuck and we're not able to recover and to repair and to rest appropriately. I often use the analogy of our bodies being a battery. When it recharges when we sleep. But if there's something wrong with the charging system, or the battery is overheating or it's not working properly, then we start to develop a mounting energy deficit. And that's where we'll talk now about energy. So energy is the available energy you have in your system. So this is mitochondrial activity, but even just your ability to harness energy through the food that you're eating, the quality of the food, but even just the ability to take that food and convert it into cellular energy, and knowing is your system working efficiently in terms of doing that. A classic example of mitochondrial dysfunction, energy dysfunction, and improper use of energy is something like diabetes. When we have diabetes, we're not adequately using energy that we eat and store, and glucose and insulin are dysfunctional. And that puts us at a disadvantage in terms of the available energy we could have. And then ultimately we want to adapt strategies to address that. If it's based on if it's type 1, type 2 diabetes, or trying to get ahead of it with these tests that we look into more in advance, and say someone who has pre-diabetes, trying to get them away from possibly having diabetes at a later point.
Yeah. A lot of those pillars, the one big thing driver is the nervous system. And
Absolutely.
people don't realize that nervous system can drive everything else that you mentioned in the system. And it's it's the biggest player. Because if people can't auto-regulate or regulate the nervous system, they're going to see things go good or go bad, depending on which way you see it. And it affects everything else, hormones, energy. The biggest one I always tell people is the nervous system. It's hard to measure, but tissue tension. So if someone's really stressed out, and you can see the research of what certain cells will do from a tension standpoint, and where they will hold tension kind of can trickle into someone's elbow issues or shoulder issues, because tension has to go somewhere so someone can figure out movement. It's got to go somewhere. And if the system's just toned up, the whole body gets reacted. I think a lot of people forget that. Oh, yeah, I really don't care about my nervous system. I don't understand this tension, but I don't get why my knee keeps hurting me or my back keeps hurting me, because they're just driving that nervous system to be hyper aroused. Let's call it
Hyper vigilant.
Yeah. And it's just going to draw attention because it can't ever just shut down, and everything's on high alert. It's such a cool thing to have insight to that, and have doctors starting to push this really into almost, hey, here's your full treatment profile. Here's what we're going to look at. Because if I came to you and say, hey, my knee is bothering me, or how's your nervous system? I'd probably look at you and be like, what does that have to do with my knee? But you're going to get to the point where you're going to explain everything in your method, your model, down to energy, down to the orthopedic side of things, how it will tie back. And I'd be, gotcha.
And you're right about that muscle tension, nervous muscle tension. And that's where I will incorporate, I have tools to do neuro and biofeedback training to teach the body to let go, to not tense up around a joint. And because you can get stuck in that impulse when you have chronic pain. And chronic pain is anything that's literally more than 3 or 4 months. And the nervous system and the nerves and the muscles around that joint start to become permanently tense around that joint. And in terms of showing testing and feedback, one of the things I like to do with patients is I have a EMG device where I can show muscle activity. And for someone who's chronically muscle guarded, you can put electrodes on a person and you can literally see that when they are sitting still, those muscles are still firing.
That's pretty cool.
No movement at all. Someone who has a history of, say, a neck or a shoulder issue, they can see on a screen that their traps are just bump, 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 bump. They are just firing up a storm. And I'll tell them, relax. And I am relaxed. I'm not doing anything. I'm totally relaxed. And look, see, you're trying to relax and your nervous system is just not letting you do it. And when you start to realize that and see the visuals, and then it starts to make a lot of sense. Why? Okay, no wonder I'm so tight. That muscle is tensing up all the time, even when I'm not using it.
I wish we could take that and put that on almost most people we see, just so they understand, even if they're lying in bed. People be, oh, I have my back pain when I'm sleeping. That's because your body is not shutting down. And it's hard for them to conceptualize, but you put them on and then that screen would be, hey, this thing is riding high and it's activated. It's okay. Here's what we get to.
Yeah, it's not always obvious. Sometimes it has to be very extreme. I work with patients with TMJ disorders. So they clench or grind their teeth in their sleep. And they don't typically understand that it's even happening until it gets to a point where, oh my God, man, this is killing me. My muscles are really tight. But before that point, if you had told them that they were tensing their jaw and their sleep, yeah, I'm fine. There's no way I'm doing that. You're joking. That's not true. So, but it's platforms, this and educational, tools that help people understand this. And I feel once the understanding is there, then they're in a position, they're more receptive to making these appropriate changes and when to getting their body and their life back on track.
Yeah. And especially from a tension standpoint, that's one that's been my kind of thing to understand. Hey, the body's got to create tension and move through space. How do we paint a picture of what's going on through someone's biomechanics rather than the old school way when people don't understand tension? How do I get rid of it? Do I cut it? Do I release it? Or do I put something in it, a cortisone shot? But as you go and then in your techniques, you don't do a lot of surgery. Yours is very non-surgical techniques to manage pain, not always saying it's tension, but tension is a big driver of where pain kind of really starts if it's not an acute injury.
Hey, I want to talk about my daily supplement routine and one of our sponsors on the show, Recommend Nutrition, which uses the top end quality, doctor-backed supplement that is in a league of its own when it comes to total male vitality and performance, supports healthy libido, desire, even satisfaction during intimacy, plus helps support strength, muscle tone, stamina, and physical resilience, as well as supports prostate health, healthy aging, and longevity. This supplement is the way to go, and it's Recommend Man Plus. They also have a formula for any women out there looking for all of those same things for overall longevity, healthy aging from the female side, and support female hormones. They also have Clear Focus, which supports sustained mental and physical energy. It has all kinds of nootropics for focus, cognitive performance, and delivers performance without jitters, crashes, and overstimulation. It's taking ingredients, putting it into an overall supplement to support brain health, mood, function. You can stack these Clear Focus Man Plus or Clear Focus Lady formula, and there's your recipe. It is quite simple. Go check out recommendnutrition.com. Use code TFL20 for 20% off your order and get on the health benefits today.
Absolutely. And there's subconscious tension very often when there's an injury underneath. So there's an emerging term that we've started to use in pain medicine called a protective trigger point or a protective spasm. So sometimes persistent muscle tightness, you're familiar with a trigger point or not, what we will find is deep to that structure, underneath that tightened muscle, there's often a pathology. There's often a tendon tear, ligament tear, connective tissue injury. And that muscle is really just trying to protect the body from having a problem at that area. And this is something that I've been, trying to share more and more with people, is that if you have a knot that just keeps coming back, no matter what you do, you see the massage therapist, you get acupuncture, you get this done, that done, and it just keeps coming back. Take a look in that area, see what's going on, because there may be something underneath that knot that needs to be treated. And if we start viewing symptoms as signals, this is a signal, then that may just be signaling to you, hey, there's a problem there. Take a look under the hood. There might be something going on. And one of the things I'm very fortunate to have in my office is ultrasound imaging. So if I think there's a problem, I can put a probe on someone and I can do imaging of that particular area. And then I can tell them, yes, that's the spot. There is a tear right there. A classic example would be, I'm sure you've seen patients over the years with persistent hip flexor tightness.
Yep.
Very often we will find ligamentum teres or labral or connective tissue tears right underneath that area of the hip flexor.
Now,
For a lot of sense, because what we hear from those types of patients is, I stretch my hip flexor every day. It just does not get, I don't understand. I'm rolling it. I'm using the tennis ball. I'm doing this. My PT says if I get rid of it, I'll be better, but it's just not getting better.
Now, do you think there could be on MRIs? Sometimes I'll have people with hip pain. MRIs don't catch it. Do you think with the ultrasound, it could be things that are more microscopic, but the
Yes.
muscle's still saying, hey, I'm holding you here because I know that this is damaged. That's the one that I was wondering. My wife had that. She had a hip thing, full MRI, everything, nothing. It was all good. I was like, there's got to be something there. And It's comes and goes, but I just still wonder if
And it may happen dynamically
Yeah.
in someone's in MRIs by definition are static. So
that's
the
tough.
hip is not moving. It's in a straightened position, which is not a provocative position. It's basically a position where it doesn't hurt, but the signs are sometimes there. And then when it comes to something like the labrum, so for the hip and the shoulder, if you don't do it with contrast, the labrum and the ligament looks identical. So you can't tell if there's a tear. It's
Gotcha.
not even possible to tell. And then, as I said, sometimes these things don't present until you do it dynamically. So with ultrasound, you can move, say, the hip or the shoulder into the position where it hurts and image it in that position and see what's going on in a more specific way. And it may not present unless the hip is in that exact position.
I see. Yeah, I never thought, because you do understand MRI. People understand MRIs. You are static. You can't move. And if people get pain from certain movements, unfortunately, we just don't have the technology to be like, hey, doc, I'm going to get you into a squat and I'm going to MRI you while you do it. And you're going to tell me where you have the pain. Because that's one of my assessments. I'll have someone go through the movement. Tell me when exactly do you have pain? And I'm trying to figure out what's going on, whether is it an tear because there's been impingement in that area? And how do I move them out to decompress that? I guess that's where the ultrasound can kind of really come in handy. To be like,
absolutely. And then you can even just read between the lines. If someone has, we call osteophytes or bone spurs in that joint, for me, that's an indication that there's something wrong with the biomechanics. There's something wrong with the way that the joint is moving, and that excess friction led to a spur or led to a calcium deposit. So most likely with that excess calcium, with that spur, which sometimes it can be pointy or have an edge to it, it's going to rip apart tissue that rubs across it. Even if it doesn't show up significantly on the scan, there's probably something going on there that's damaged.
Absolutely.
So it's worth taking a second look at and seeing, okay. And then also from a root cause standpoint, identifying, okay, why are they getting those spurs? What's wrong with that movement pattern, or the biomechanics, or we call it the arthrokinematics, or the joint mechanics of that joint that would cause you to develop that spur? Is there hip impingement? Is there shoulder impingement? Is there decreased glide in a particular direction? Identifying these things helps someone get out of pain immediately, actually, by improving joint mechanics. And then ultimately, it's something that should be in their long-term plan in terms of preventing something like this from happening.
Spot on. Couldn't agree with you more. And I love like-minded people bringing biomechanics, because the body just something doesn't happen in the body without something else occurring to it from a biomechanical standpoint. So as you have these things show up, people always think, oh, it just happens. No, something had to have been causing it or continue to cause it to have that get there. And I'm sure that's another hard conversation to have with people. They're just, I don't understand, because they're not also looking at how biomechanically we compress and decompress our system thousands of times a day. And if we do it in a poor pattern, unfortunately, that pattern can get overused and overworked, and tissue can get degraded at some level, at some point. Or we have a lot of athletes that they put a lot of force into the ground or into whatever sport they do. They structurally are overusing a pattern, which isn't a bad thing.
Yeah.
But they're just stuck in the pattern, or they don't have the structural biomechanical strength to kind of handle that force. And things, I always tell people, if they have shin splints, your shins are so strong that they're pulling the bone apart. And they're, oh, damn, my shins are strong. Yeah, but it's causing pain. So we got to figure this out.
Definitely. Yeah, one of the things that you can do with ultrasound, and I think we're a long way away from this being incorporated as an assessment tool or in practice, but you can look at tissue quality, so you can see what the quality of the muscle looks. Is it strong, thickened, striated muscle fibers, or is there what we would call fat atrophy or fatty deposits in the muscle, or calcium deposits in the muscle, which often is from something overuse. Overloading a muscle, just the bone, the muscle will fill in a little bit of calcium in the area to make it stronger so it doesn't tear. And that will not only make the muscle tighter, but now it's not as contractile.
Right.
So now that muscle doesn't work as well. It doesn't, the performance and the function of the muscle isn't as good.
Are you starting to do a little bit of that in your practice now? Because that sounds
Yes.
something I would tell a lot of my athletes, hey, you got nothing there, but I would be scan the muscle. Let's see what this thing looks like.
Yeah.
It's going to tell you
mean,
a lot.
I do that. Yeah. I like to think of it. I tell the story of that whole area.
Yeah.
You know, you can see the old injuries that someone has had. You can see old scar tissue from a prior injury. You can see the areas that have had excess stress on them that maybe have a little bit of that fatty atrophy or calcium deposits. When you could see the areas that are more healthy, that have been treated more adequately and loaded more appropriately. And then that helps to dictate what strengthening and what exercise program would be more ideal. And that's why I'd love to see more of this back and forth with strength and trainers and all of that. The two gentlemen who taught me my ultrasound training, I was lucky enough to help them teach last year at FATS, which is the Professional Hockey Athletic Trainers Association meeting. So with the NHL and their affiliate teams, the athletic trainers are now starting to learn ultrasound so that they can implement it into their training programs and do stuff just like this, identify injuries, and even just look at tissue morphology and how people are progressing so that these athletes can stay performing at their peak and that they can catch injuries hopefully before they, become a problem.
That's huge. And you're also using ultrasound in Altpoint. Walk us through what that is, how you use it. And this is cool things. If someone goes to your website, they can read all about it. But you're also saying that you can heal some things that might not need surgical intervention, that people might also, they don't want to have surgery. How many clients, I have someone, I have left frozen shoulder. They don't want to have surgery. I respect that. How can we make them live their life to manage that labral tear and do that? So Altpoint, walk us through kind of how you came up with it, how you use it.
Sure. So Altpoint is based on a technique called ultrasound guided galvanic electrolysis. So it's basically delivering electrical current through an acupuncture needle into a site of injury. The technology was originally pioneered in Spain in 1999, and they've been doing it in Europe for the past 25 plus years. I work with a number of docs that do PRP and stem cells and stuff like that. I've attended conferences, and about 3.5 years ago, on one of these message board discussions, someone mentioned this technique as an alternative to PRP for this particular case that we were discussing. And none of us had ever heard of it. When I asked him about it, and we struck up a conversation, and he's based in Germany, sent me some of his research. I started to do some investigation on it, and I was, wow, this is actually pretty impressive what it can accomplish. It's less invasive than a PRP or any injection for that matter. And through his help and speaking with others, I was able to basically engineer a device so I could do the treatment here in America. And I've been doing that for the past 3 years, collecting data, and it's been remarkable. I'm able to, using the ultrasound, I can diagnose the injuries, no different than doing a guided injection PRP. You can place the acupuncture needle in the site of the injury, and then the current creates that stimulus that catalyzes healing. So it's obviously less painful than having an injection. And then because there's no fluid being introduced, there's significantly less soreness, and people are able to get back to play sooner. They use this very often with acute injuries in Premier League soccer. In fact, I read this one article that came out of Premier League soccer that basically was, after I read it, okay, I have to figure out if there's any way I could do this. They had a group of players that had partial thickness, but significant grade 2, grade 3 rectus femoris tear. So that's a tear in the quadricep muscle. And they did this treatment for 3 weeks, and all of the athletes were back on the pitch, as they say, playing soccer by the 4th week. And knowing that the etiology and the history of that type of injury with any treatment, it's typically 6 to 8 weeks minimum. Yeah. The fact that these individuals, not only were they all better functionally. They were back playing in that time. That really turned my head. And I was, okay, there's definitely something to this if it's able to really speed up that process so quickly.
Yeah, and that's the coolest part about this modern technology about healing. And even you go to the website, you have some cervical cranial instability. You're treating not just acute injuries, but maybe longer term injuries that people might make. You don't have to be an athlete. You might have just certain dysfunctions and certain pathologies that have just been there, or years of sport created it, that you can now treat without going in and slicing and dicing and changing a whole environment. It's cool that we can start to push the technology of medicine for healing to become quicker, better, and more efficient. That is just so cool.
It is. It really is. And it's a much smarter mechanism because helping the body to heal itself is always going to be faster than surgery.
100%.
Surgery requires considerable time for the body to adapt to the surgical procedure. There's rest, there's time where you're not using your muscles. That's a lot longer. So you may end up at the end with a comparable outcome, but the time off, the time that's required for you to rest, and the time and the effort that it takes to get back to function is significantly more. I've been able to this year successfully rehabilitate 5 people with complete ACL tears using the all-coin and what's called the cross-bracing method. So it's a particular type of knee bracing method where you brace the knee at 90 degrees and then you slowly straighten it out over a period of time. This is a protocol also out of Europe. And if you're familiar with ACL recovery, most people are back, they return to sport typically within about a year.
Yeah.
Best case scenario, 10 or 11 months. All of the patients that I worked with, they were back within 6 months.
Wow. That's crazy.
And it makes sense because they did not have to rest for as long. So there wasn't the same type of muscle atrophy that set in. And ultimately their body healed. So they were able to do it much faster. And long-term, this is going to be better for those people because now we didn't drill into bone. We didn't affect the integrity of those knees. And I think that's important on both extremes. So if we do an ACL repair on a young individual, a high school kid, young college kid, that knee is going to age much faster.
Yeah.
They're going to end up with arthritis much quicker in that knee. They're going to need a knee replacement. So for those 2 of these individuals were kids, my hope is that this helps them avoid future knee surgeries for the rest of their lives, barring any additional injuries, which will happen with kids. And then on the other extreme, the other 3 individuals I worked with, they had moderate to advanced knee arthritis, and had they had the ACL surgery, there would have been a high likelihood of them needing a knee replacement in the short term. When that's what I explained to them going in, I said, we're doing this to hopefully help you avoid a potential knee replacement, because if you have the ACL surgery, it's a virtual certainty that you will need one because of their knee would end up more worn and more affected after the process.
It's really changing the whole game of medicine for the long term of a human's life, not just, hey, you repaired the ACL so you can go play, because ideally most of us aren't going to make it to pro sports, but you're going to have this knee for the rest of your life, which is cool. The technology is awesome that we're getting to push this further and further. And I know we're coming up on an hour, and I always respect doctors and coaches' time. Where can people find you and find about your practice and all that stuff?
Sure. So my website is drshawnaltman.com. My main office at this time it's called Reverse Time Wellness. It's located in Stamford, Connecticut. It's a very unique medical wellness center where we do sports, but we also do aesthetics and men's health, women's health, a little bit of everything. And it's all geared toward this concept that's really emerged over the past 5-10 years of longevity medicine. So on that long term, focusing on not what's best for your knee or your back or your body for the next year or 2 or 3 years, but what's best for the rest of your life. How are we going to optimize what we call your health span? So that's the number of healthy years that you live. as opposed to your lifespan, which is the number of years you live. And that's really the goal behind many of the interventions. And just my overarching philosophy for patients is thinking about the long term. What is best for you, for your long-term goals, for your body? How could we keep you moving, keep you happy, keep you healthy as long as possible?
Exactly. Awesome. I appreciate you coming on.
Matt Gluckman and Eric Menchie here from Think Fitness Life. Our entire careers have been dedicated to fitness, particularly how the mind helps the body. We've been around gyms and nutrition strategies for 25 plus years collectively, and nothing harms or helps better than your own mind, untrained or trained. Pushing beyond your limits, overcoming whatever's thrown your way, and making the decision to show up day in and day out as a lifestyle takes more soul than sand. And what I mean by that is when you can get your mindset and heart leading you consistently in the direction of your goals and dreams, well, it's just a matter of time before you have the performance, physique, or quality of life you're yearning for. See, your thoughts will stem from your beliefs, which will then lead you to action, which develop into your behavior and ultimately lead you to results. It's really that simple. Our process takes time and it takes open communication. It's amazing what pops up along the fitness journey to betterment, and we can be there every step of the way. To learn more or apply for coaching, visit www.thinkfitnesslife.com. Start recreating your life today.